Good afternoon, everyone. My name is Denise Mananis. I am the Assistant Vice President for External Affairs for St. John's Riverside Hospital, and I'd like to welcome you today to our presentation on feeling stressed, depressed, anxious. Maybe it's time for a self-check-in. But before we begin, I would like to thank my team for producing yet another seminar for our community. Jason Latour, who is our producer, Nancy Anabi, who is our community liaison, and Candace Cousins-Hopkins, who is our Associate Director of External Affairs. And they're a great team, and so we thank them. Also would like to thank our partners today in helping to bring this information out to the community. Sally Pinto, who is from the Yonkers Neighborhood Naturally Occurring Retirement Community, which is under the umbrella of the Yonkers Office for the Aging and Westchester Jewish Community Services. We thank you. And we also thank Z Baird is from the Yonkers Public Library. 3 locations for that, and they're all beautiful locations, by the way. The Riverfront Library, the Will, and the Crestwood Libraries. So we'd like to get right into our program. So I'd like to right now take this opportunity to introduce our speakers. First joining us is Michael Kennedy. He is the Assistant Director of Behavioral Health and Detox at St. John's Hospital. He holds a master's degree in public administration rather, an advanced credentialed alcohol and substance abuse counselor, and he will receive his MBA in Health and Risk Management in Healthcare in May. Michael began his career in the field of addiction and counseling at St. John's in 2009 and is passionate about helping, advocating, and assisting those in need. So thank you for being with us today, Michael. And also, I'd like to introduce Lisa Ross, who is a Senior Administrative Nursing Supervisor within the Behavioral Health Department at St. John's. Lisa holds a master's degree in nursing from Grand Canyon University and is board certified through the American Nurses Credentialing Center as a psychiatric mental health nurse. For over 25 years, she has cared for adult patients with mental illness and substance use in a variety of settings, including hospital inpatients, outpatient programs, and in the community. She is passionate about delivering the highest quality care to this vulnerable population and believes in the simple motto of do unto others as you would want done unto you. So thank you, Lisa, for joining us today. Before I start with some questions that we have prepared and that we have from our audience, I wanted to start with sort of setting the tone of the discussion, which is, I recently, if you look in the news, and I actually just read something recently in Newsday that quotes, 2 years into the pandemic, nearly a third of Americans report symptoms of anxiety and depression, triple the pre-pandemic number, as they adjust to shifting ideas of what the new normal will look like. And with continuing concerns about getting sick, the effects of earlier and current social isolation and uncertainty about the economy, mask mandates, and vaccines are among all of the reasons. This is a sentiment that we are hearing everywhere, so we thought it would be appropriate time to check in with our community to discuss what is being seen, how you can check in with yourself or your family members and recognize signs of trouble before it gets out of control. So I'm going to ask the first question of Lisa. Have you noticed any behavioral changes within the community or perhaps with your patients since COVID happened 2 years ago? And if you do you feel more people are seeking help for anxiety and depression or not?
Yes, great question. History has shown that the impact of mental health and disasters outlasts the physical impact. So we have seen some definite changes since the pandemic. We've seen an increase in people, first-time admissions. These are people who present for the very first time with behavioral issues. Michael and I were discussing that we've been noticing that cultures that don't typically seek treatment are coming in for treatment. The Hasidic culture, Indians, we've seen them come through our doors, which was a little surprising because we haven't typically seen that culture. The acuity on the units, We're having a lot more aggressive, violent patients. We're having a lot more patients on suicide watch than we had before the pandemic. So the acuity is up as well. And we've been noticing that our patients are coming in with concurrent substance use. So they're using multiple substances. So it's no longer just what's your drug of choice, because they're using alcohol and heroin and cocaine and amphetamines. So we're seeing this. And yes, the numbers have increased, the number of patients. And you couple that with the fact that most inpatient units have had to cut their census due to social distancing. So we haven't had as much beds available. The good news is that COVID rates are decreasing. So most facilities are now increasing their censuses. But this pandemic has been especially hard on the youth. We've seen a lot of young people come as well.
That's interesting. So that you're seeing that in the clientele that are coming in for treatment, but what about generally out in the community? Are you seeing, you were mentioning you have seen different ethnic groups coming in. Are you seeing different ages? Are they reporting that the pandemic is part of the issue for them?
I don't know that our patients come in and say that it's specifically because of the pandemic. They may not use that term, but the isolation of the pandemic, they may say. So those type of things that the pandemic has caused are contributing factors. But inpatient beds for our adolescent population is very hard to get right now. So the youth in particular, they have struggled.
So can you enlighten us as to what are signs of trouble? So if I'm out in the community and I have, kids ranging in age from 15 to 25, or I have parents who spend a lot of time alone, what should I be looking for? What are the signs of potential trouble?
Okay. So a generalized statement may be whenever there's a significant change in behavior. But for an alcohol or substance abuse use, you might say things like very practical things that you might observe is that someone's filling up their glass a lot more taller than they did, or they're finishing a bottle quicker. They're waking up and having early cocktails, mimosas every day. They start to lie about their usage. Family and friends are voicing concerns. They're going through prescriptions faster. I'd like to say things like, it's not necessarily what you drink, but rather the impact that it has on your life. So there could be somebody who only drinks once a month, but that one time a month, that person is verbally and physically abusive. They're destroying the house. They're going outside and having DUIs, getting in trouble with the law. That person has a problem, although they drink once a month, only once a month. Anxiety, if they're waking up with feelings of apprehension or dread, restlessness, irritability, always looking for danger, always thinking the worst, that could be a sign. Depression, if you're, not able to sleep, changes in your sleep, your appetite, loss of concentration, physical aches and pains, in which people, this is some of the things that sometimes they go to the doctor and present with, but this is a sign, this could be a sign of depression, and your doctor will help you with that. But those could be some signs.
Okay. Michael, how about you? So how do you help people who have never had to really take a look at their own behavior or look at the other people in their family's behavior? What would you say to them, to do a self check-in? How do you instruct someone to do that?
That's a good question. Many times we don't do self check-ins until something happened, something occurred, and then you want to say, how did I get here? So you want to start reflecting. But the better way to actually do it is as a preventive measure. We need to understand that checking in with yourself, it's something it's It's focused, it's purposeful, it's deliberate. When you do it in a healthy way, you're doing that throughout each day, really. You're carving out a period of time where you're really looking at your emotional self, you're assessing your physical self, you have intentional plans. A lot of us, we don't do that. Like I said, in the on the front end, we do it on the back end. I would tell people to check in with themselves and how to, as if they're talking to someone else. And I utilize that myself with saying, like, how are you feeling right now? Like, what's going on with you? How you feeling? Um, is anything deterring you at work, at school, with the children? Do you feel stressed? What do you feel good about? Is there something that you're looking forward to? Do you have a day off coming from work, a day off coming from school? Um, who are you checking in on each day? Do you have a parent, that's living by themselves? Do you check in on them? You want people to just start really looking at saying, something's going on, but I need to assess it so that I could prevent it instead of letting it go on. And then it creates a problem. There's an old saying that a problem is not a problem until it becomes a problem. Okay. You try to focus them on a way of how to focus on looking at that. And that's when I try to tell people, focus on there's a thing called the social determinants of health. Focus on it. Focus on community. Focus on the job. Focus on your health, your finances, your education. That's a holistic approach when you're doing a check-in. A lot of people just check in sometimes really on what's the immediate issue, not the overarching issues. And we could take care of the immediate issue, but the overarching issues are the things that are really affecting us. And believe it or not, that accounts for up to 80% of health outcomes.
Wow.
The social determinants of health, if you don't take care of them, they really lead to physical stressors. So it's necessary that we do that in advance and as daily as possible.
Right. So for people who are not used to thinking in these terms, in terms of stopping, reflecting, thinking about these things, and to use your words, sort of thinking about the overarching things that make up one's life. If you know that you are experiencing insomnia or anxiety or depression, and you take that moment and you think about these things, how do you know when you need to seek professional help or when you need to intervene for someone close to you? And then there's a question follow up to that, but how do you know when you're supposed to do that, and how do you explain to people that, what the process is for that?
Okay. In clinical, we assess people through, a tenfold criteria when it comes to counseling. And some of the behaviors are basically, they can be considered normal or regular. That's why you have people you consider a social this or a social that. It becomes when it's out of their control to be able to cope and self-regulate and monitor when they're struggling with work, when they're unable to handle stress, and normal coping activities or strategies, they no longer work. When they start going outside of themselves and start using things such as drugs or alcohol in order to find a medium, when it's difficulty maintaining a good appetite, or when you got significant weight loss, they're engaging in risky behaviors. And at one point or time, they were more conscious about risky behaviors. Real problems focusing. When it reaches those limits or those degrees, that's when I would say that they need to seek professional help. They're no longer able to self-regulate and pull themselves back, because now it's becoming something that's not just affecting them personally. You start seeing it affecting their work life, their family life, their social life. Every aspect of their life is starting to be impacted by these behaviors.
So Lisa said something earlier about that person who only drinks that one time a month, but goes on a bender. But
Yes.
yet they function. How, if you're watching that person, how do you speak to someone about, do you understand the interruption that this is causing in your life and in your family's life, and how do you bring that subject up and get someone to focus on that and get them to recognize, I guess, the reality that that's still an issue.
Okay. And it is an issue. Good question. Lisa brought up something that if we diagnosed it, it would be called abuse. It's not even regular use. But when you use, and it affects everything around you. First thing you want to do is you never want to try to bring that across to a person while they're actively using. You really need to create a safe space in order to have that conversation with. So you want them to be sober, first of all, when you have the conversation. And then you don't want them feeling as if you're berating them or making them or beating them up or making them feel like they have a problem and everybody's recognizing it. What you really want to do is you want to use a motivational interviewing technique. You more so want them to figure it out by you basically parroting a conversation with them. Hey, I know it's sometimes when you drink, man, it's those days you do drink, I look at my watch and say, I'm getting ready to leave. You want to create a safe space where the person will look and say, what do you mean by that? And soon as you get anything that the person is basically attentive to it, that's your foothold in having a conversation. So you have to, first of all, create a safe space. Most people who are at that stage of usage, you're able to have a conversation with. It's easier than catching someone after their rationale has been diminished because they've been basically dependent upon the substances that they're using. So I would say motivational interviewing, getting them in a safe space, um, even talking about people in the third person, um, or speaking about some of your own issues that have nothing to do with alcohol, but they're interrelative to someone just having episodes that are not controllable. And it's only when there's an external factor that plays a role.
Very interesting. Okay, so we're talking about stress, depression, anxiety, and the heightened levels, and how people are doing things that they think will make them feel better in the moment. But are there other, and Lisa, I'm going to direct this first to you. Are there other ways, positive ways, that we can cope with stress, depression, or anxiety that do not involve having that drink, taking that drug, walking the floor all night long? You know, how can we mitigate all the things that we're doing that are negative? What are the positive ways to cope?
Yeah, there are some positive things that a person can do to develop healthy coping mechanisms. Lifestyle changes. You know, there's nothing I'm going to say that's probably new, but what I want to say is it doesn't have to be an all or nothing approach. So, small steps. You can exercise. You don't have time, go on your lunch break. Maybe instead of taking the elevator up one flight, take the steps up one flight. Walk around the mall. Small steps. Step challenge with friends. There's lots of apps. Do a step challenge with friends. Eating. Again, start small. Small changes. Eliminate certain foods. Eliminate the bread and maybe the rice, and maybe not all at once. Maybe just a couple of times a week. Try eating when you're hungry, not to satisfy an emotion. Self-care, that's a good one. Self-care. Um, recently my daughter started lighting candles all over in her room every night. And I said, hey, I'm going to go to TJ Maxx, buy a candle for $10. I started doing the same thing. What a positive effect it's had on my mood. Like lighting a candle, reading a book, taking a bath, do things with intent and purpose. Wake up in the morning and ask yourself, what's your purpose for today? And a good one that I like is avoiding procrastination. We don't realize how stressed we get and overwhelmed because we put things off to the last minute. Avoid procrastination. Create to-do lists and stick to them. Sometimes we have to tell people no too. Don't pile too much on your plate. Sometimes just say, I'm sorry, I would love to help you. I don't have enough time right now. Maybe you can suggest somebody else that can help. So I think these are some positive ways we can cope.
Yeah, that's very interesting to me because, again, I think it's very easy for us to look at people in our lives and recognize the issues outward, but not always remember that we have to look inward and we have to find ways to be kind to ourselves and put some of those same kinds of limits on ourselves. Michael, I wanted to go back to you. Are there any behaviors that you can change or that someone can change or be mindful to avoid causing further harm?
Denise, when that question, there's a few words that jump out. Um, Behaviors, change, mindful. There actually is a state of awareness that's called mindfulness. Mindfulness, it's the awareness that really comes up when you're paying attention to the moments in the present that's going on. Um, People, you want people to initiate and maintain behavior changes because it's a key to treatment, and as it all ties in, it really helps prevent chronic medical conditions, whether people know it or not. Um, One thing that we have to do, or which I try to tell people, is they have to start identifying options. Like, there are options to most things that we go through. We just don't identify them. Rather, we just go through them. But we have to identify them, and then we have to actively learn how to cope with them. Because if we don't, that's what's going to cause further harm. To change behaviors, Lisa said the key to something, and I think she probably read my notes, but it was about taking small steps. You really have to do things in increment. A lot of times we just want the big boom to hit us and solve everything. And when it doesn't happen, we set ourselves up for failure. But we have to use emotional coping techniques. We have to practice better communication skills. What I said earlier about self-regulation, that's really the ability to adapt, like, and regulate oneself and their attention, their emotions, their thinking, their behavior in the moment, and effectively deal with internal and external activities, things that are going on. So if there's some way that you try to teach somebody that, it really comes down to how to avoid the avoidance. A lot of times we don't want to deal with something, and that's why it's hard to change behaviors. I once heard someone say, a leopard, people don't change, they just camouflage their spots, like a leopard.
Right.
You understand? They don't change. I beg to differ because of the field that I'm in. I see change all the time. So it's really how people need to understand how to avoid the avoidance and cope with the issues and the behaviors that are going on, and be mindful of it. You have to be in the moment of the behavior to change it, because a lot of times we don't see a problem with our behavior until it starts affecting us and have negative consequences. I lost this because I'm yelling and screaming, so people don't want to sit down and have a conversation with me any longer. So you're losing friends. So how do you change that behavior? You measure your tone when you're in a conversation, and especially if it's one that you're getting ready to go into, that that has the ability to become volatile. Self-regulation, so it doesn't cause further harm.
Right. Very interesting. Okay, so Lisa, what are, or Michael, or both of you, what are the progress markers that you should be looking at when you're dealing with depression, anxiety, and stress? So if you've now made that point of being mindful and you recognize that you're acting in certain negative ways to deal with those things, and you're now trying to move to a new place, how do you measure progress? How do you know when things are getting better?
Some things are simple. If your symptoms are under control over time, you're improving, you're getting better. If you notice that your usage is decreasing, if you're not waking up with the cravings, you don't feel sad as often, you're having fewer bouts of anger, you want to socialize, now you're looking forward to going out with friends, you're probably going in the right direction. If your thinking is more clear, if your appetite is returning, you don't feel as tired, you're probably going in the right direction, you're improving. But one thing I think people need to know is that relapse is part of the recovery process. So when somebody slips up, or if you slip up, it doesn't mean you're never going to succeed. Relapse is part of the recovery process.
That's right. And for me to piggyback off of that, Denise, many people, after they made some progress and recognize it, when relapse, if it occurs, they become so hard on themselves as if they have to start all over. And that's not the case. You need to pick up where you left off at, and you need to keep moving. You need to keep forging ahead. Many of the times that we look at why we're in the place that we're at and how did we get there, it becomes that's stressful. Anxiety tends to set in. But when you start seeing the progress of, I'm not going to smoke a cigarette, I'm going to chew some gum. You understand? I'm not going to have a drink. I'm going to go get me some water. I'm getting ready to get in my car and go to the store, but the store is around the corner. You have to really self-monitor yourself, because a lot of times you don't have other people paying attention to you in order to say, here's a pat on the back, you're doing a good job. You have to learn how to be your own fan base many of the times. So it's about really being cognitive and cognizant, rather, of the things that you're doing, and understand that what progression is. A lot of times I think because of so many failures or setbacks, we get used to that and we don't even understand, or we miss the perception of what success is. And success is incremental. It doesn't happen all at one time. So we need to just take them little advances and learn to build on them.
Like, just to jump off of what Michael was saying, one good thing to do is journal. Journal how you were feeling, what you did, how you felt after. Journaling is a wonderful way to see your progress, to measure your progress.
That's very interesting. I know that both of you, and I'd like to give just a shout out to both of you, because you really work with people who are in an acute situation, and often in crisis situations, dealing with the manifestations of their anxiety and their stress and their depression. And all of the folks who work in our Park Care Pavilion with our inpatient and outpatient clients and patients really do an incredible job. And we have that information for the public who may need it for themselves or for family members. We are always here. But I was just wondering, in terms of resources, for people who don't need that level of care, are there places that you can recommend that that people can seek information and help and kind of go down that road a little bit? What do you think? You got anything?
Yeah. NAMI is a good one. NAMI. That's the National Alliance of Mental Illness. That's a wonderful resource for everybody. SAMHSA, right? Substance Abuse and Mental Health Services. That's a wonderful resource for everybody. National Suicide Prevention. There's a hotline. That's a resource. And there's the National Institute of Mental Illness. If you want to just go on there and look at what research is being done, that's a good website to go to.
Great.
Yes, and I concur with Denise, especially when she said SAMHSA. They have so many resources in themselves. I mean, they literally have a telephone directory with thousands of resources.
So people can do their research and go online and look up for whatever kind of issues they're dealing with, and there would be direction for support.
Yes, it is. Direction, telephone numbers.
That's great.
That's right. Contact information.
Great.
Yes.
And at the end of our program, which we are coming to, we do put up our email as well, which is info@riversidehealth.org. And if anyone in our audience has any questions or has other requests for information regarding any of the things that we've talked about today, feel free to use that email, and it actually comes to me, and I will make sure that it goes to the appropriate people to answer that question, like Lisa and like Michael. Okay, any other thoughts that you want to share, or did you think we covered everything for you?
My one thought would be, Denise, for me to bring this to close the loop, is when people are going through something difficult or confusing, chaotic, it's simply provide a space for them to share their thoughts so they could talk through their experiences, you know, without judgment.
Yeah.
Some people want to talk while others really don't. Sometimes it's okay to just sit in a quiet space with them. A lot of times people want to share and they don't know how. And they don't know how from past experiences or being judged in what they're going through. The first thing I've heard a nurse say a while ago was like so prolific. She said to a patient said, I don't feel safe here. And the nurse said, what is safe to you? What do you consider safe? And when she said that, like, the whole conversation opened up. The woman stayed, she didn't leave, she didn't AMA. But we have to understand what is safe to people. And the first thing is to provide a safe space. So that's what I would want to end this with on my behalf. That's
very interesting. Well, I'd like to thank both of you very much. You know, again, you guys do an amazing job. It's a really tough job, and it's a necessary one, unfortunately, with the life and society that we're in and the issues that we all face. So thank you both for being with us today. Okay.
Thank you.
You're very welcome. And what we're going to put up on the screen now is a reminder for our audience that we do have virtual urgent care, and if anyone in the community needs to see a provider, that is a great number to call, 964-4429. We'll get you on with a provider and to determine where you should be or what you need. And then next, for general questions, I talked already about info@riversidehealth.org. Certainly you're welcome to call the hospital as well, and that's the main number, 914-964-4444. And always, if you need a provider, you need a doctor, find a doc at riversidehealth.org or 964-4DOC. And I think, are we good? We're good. So thank you all for being with us today. We really appreciate it. And this will be posted to our social media. And please share it with everyone who wasn't able to join us live today. Thanks for being with us. We'll see you again soon.